Hi, today I'm going to show you why prolonged or repeated bending or flexion of your low back is so hard on the discs in your low back. My name is Roxanne Meldrum and I'm a physical therapist with PT Health Academy. I have a spine model here to show you why I'm really trying to encourage people to replace their bending with hip hinging when it comes to treating low back pain. Your spine is made up of bones stacked on top of each other with the disc in between. The spinal cord goes down the center, and then you have these nerve roots that come out the side. They come out holes made by the two bones that come together. Now in this spine model, this is the front and this is the back, so my model is facing that way. Now what this model isn't showing is that the disc is actually attached bone to bone. This looks like it's free floating, but it's not. It's attached to each of these bones. And it's attached by its outer layer, and that outer layer is made up of tissue that functions much like a ligament. So I'm going to add some ligament so you get the idea of what that looks like. So here's ligament. And while I'm only putting on a portion of it, understand that that actually goes all the way around. But this is the portion that is most often damaged. If you spend a lot of time in prolonged bending or flexion, meaning like in sitting, you can see, let me stick this on a little tighter. You can see that when the spine bends forward, it tugs on that ligament. And that's fine for a short period of time, but if you sit like this day after day, hour after hour, 8 hours a day, 40 hours a week, plus your 45-minute commute in your car, and then you go to the gym and you touch your toes a million times, do crunches, things like that, that repeated bending, that repeated flexion, then over time, this ligament will tear, will fray and tear. And here is an example of a frayed or torn ligament. So you can see now that I'm starting to tear that outer layer of the disc. And once that tears enough, the inside material of the disc will actually push through that tear. And that's how you get a bulge or a disc herniation. So what do you do about that? Well, just like any tear or cut, if you keep those edges approximated for long enough, then you will scar over that tear. I put a little extra piece of tape on there that says scar. You'll scar over that tear and restore some of that outer layer. The problem is that scar is not as strong as the original tissue is. So what happens when you go back to that repeated or prolonged bending and flexion? Then eventually you will tear that scar. And this is often what I see in my patients with low back pain. They had an initial incident, it recovered fairly quickly, and then they had another incident, and that second incident lasted a little bit long, it was a little bit more painful. And then that third incident laid them on their back for 2 or 3 days, they missed work, they started to have pain down their leg, and it was much, much harder to recover. So what's happening is that each time you spend too much time bending and flexing and tearing that outer layer, it will scar down over time, but then you return to the scene of the crime, back to that chair or whatnot, and you repeatedly tear it. And it's harder and harder for it to heal each time. The tissue's getting more and more frail with each subsequent tear. When I work with patients with this problem, we spend a lot of time learning how to not pull on that outer layer of the ligament so that you learn how to hip hinge and squat in ways that prevent that repeated bending. You learn how to sit in a chair in really good posture and take lots of breaks so you don't add extra stress and strain to that outer layer of the disc. If you can live in an environment that allows those edges to heal up and scar down and then stay in that environment, you can prevent subsequent back pain incidents from happening. I hope you found this helpful. If you did, please like and subscribe. It really does help my small business grow. Thank you so much for listening.